Okay. Good morning, everyone. My name is Lindsay. This is Allie, and we are presenting on equine health in and outside of Ireland. So, just to preface, Ireland's status as an island provides a natural barrier that helps protect its horse population from many infectious diseases. This geographic advantage, combined with strict import regulations, quarantine procedures, and a strong veterinary oversight, has been key in preventing the introduction of several serious equine illnesses. As a result, diseases that are present in other parts of the world are not found in Ireland. Maintaining this disease-free status is vital for the health of the nation's horses and supports Ireland's reputation as a world leader in the breeding and export of high-quality horses.
So next we're going to talk about diseases that have been reported in Ireland. First one is equine influenza. The major symptoms of this disease are coughing, a fever, and a loss of appetite. It is a highly contagious respiratory infection and that attacks the horse's respiratory system, and it spreads very easily, and it's spread through contaminated objects and air particles.
Okay, the next virus is herpes in equine. Its major symptoms are fever, nasal discharge, head tilt, and weakness in the limbs. It is caused by herpes virus that affects horses worldwide. It has reproductive and respiratory symptoms. It's not zoonotic, and management is achieved in good breeding management, and there's often vaccines for it.
The next one is equine metritis. It is an inflammatory disease of the reproductive tract of the mare. It is caused by Tailorella equigenitalis that can result in temporary infertility. Stallions typically are the ones that carry this disease and can give it to the mares. And the last known case of this disease in Ireland was in 2013, but it is not currently prevalent in Ireland. And the major symptoms of this disease are infertility and vaginal discharge.
Okay, some diseases that are not present in Ireland. We see rabies in horses. Major symptoms are typically what we see in wildlife: aggression, anxiety, lameness, colic, and fever. And it's a fatal viral disease that occurs when a horse is bitten by a rabid animal. In North America and Europe, rabies has mostly been eliminated in domestic animals and equine, although it still affects wildlife, which is what we see with raccoons and possums. In horses, the virus can be in the body for days to months before signs develop, so this can be extremely fatal for horses.
The next one is dorine, which is a protozoal disease. The major symptoms of this disease are genital tract edema, mucopurulent discharges, abortion, pathogenomic, silver dollar plaques, which are skin lesions. This affects breeding stock and is transmitted directly through breeding or occasionally, in some instances, from the mare to the foal. And unfortunately, it is commonly fatal in horses.
So another disease would be equine pyroplasmosis, and it's a tick-borne protozoan disease. It causes from a bite. Clinical signs can be broad and nonspecific. It can also be spread by contaminated needles from a horse to another horse or an animal to another horse. And infected pregnant mares can pass it to their foals. And disease is absent in Ireland except for an imported horse last year. And that horse was tested and returned to its country of origin, and there was no cross-contamination that occurred. Common symptoms are fever, jaundice, hind end weakness, and anemia.
So next we're going to talk about prevention of disease, especially when entering or bringing horses onto the island of Ireland. So adequate nutrition is extremely important, making sure horses have all the nutrients they need to stay healthy and to have a strong immune system to fight off any diseases that they might be exposed to. Then we've got isolation and quarantining any new horses that come onto the island, especially from other countries, and also quarantining any sick horses that might present symptoms of any illness that are currently in Ireland. Disinfection of hooves is a major thing, especially when importing horses, walking them through different solutions especially when they're coming off the plane and going into quarantine, is extremely important to prevent the introduction of new diseases into Ireland. Having well ventilated areas in barns helps prevent diseases that are spread through air particles from being spread throughout barns and in stables. Stress reduction is extremely important. Horses that are not stressed and relaxed are more likely to have a stronger immune system, which in turn will help them fight off any diseases that they're exposed to. Vaccinations, especially core vaccinations and even risk-based vaccinations, are extremely important. In addition to minimizing new horses' contact with any resident horses, which goes along with isolating any new horses and quarantining them, whether they're being brought from a different country or just being transported to a new barn within Ireland. And then semen testing is really important, especially for breeding stock, to prevent the transmission of sexually transmitted diseases between horses.
And here are our citations.